Very good morning. So we'll be talking about humans versus technology, how much uh, to be used in the healthcare. So if you see, there's some data. Despite 33 percentage of global rise in telehealth consultation since COVID, a 21 study found that 70% of the patient appreciate the digital health tools, but 60% worry about the reduced face-to-face interaction with the doctors. There is something which has come into the healthcare, I think you agree with me, known as flipped care. So now most of the time, average time which a patient spend with a clinician in the entire year is less than 8 hours. However, he spend on the flipped care around 5,000 odd hour in the entire year. So you can see the interface between the patient and the doctor is going down and down. But I think if it is a good mix of both, I think we can make a difference, and patient experience also makes a difference. Like I represent Ahmedabad, we have not lot many non-resident Gujaratis who used to come every year, to take healthcare services. So some of the people, when I used to talk to them, they say whenever they're in US and they call an insurance company, it goes to a call center, dial 1, dial 2, dial 3, and they feel so disturbed. While they come to India and they call a customer care number, some a pretty lady will pick up and say, how can I help you? Oh no, I think so we have to talk about those things, and I'm happy to see four great leaders in the healthcare who will be talking about what makes and how much to be used in the healthcare, human interface versus technology. So I'll go to Dr. Emmanuel. So first question to you: how can healthcare providers strike a balance between technology for efficiency and ensuring that patients still experience a personalized and an empathetic approach in their care?
Technology is here to stay. You cannot say that you will not use technology, and we will see more and more adoption of technology. But how do we balance this? This is going to be the most important challenge. It's two ends of the spectrum, but to make a perfect harmony, these two have to be in perfect balance. Otherwise, we will get it completely wrong. So I think human touch is very important, but along with that, there are a lot of things which technology cannot replace the human touch. Just the tone in the voice, just a reassuring word, the way you communicate these things, and just a touch, just a pat on the shoulder. All these things make eye contact. All these things make gestures. These kinds of gestures make a major impact on the patient, and their confidence levels goes up because of that. But sadly enough, the time that they get for all these things are very less, and that is where the technology needs to come in. Technology needs to come in to enhance and augment the information that they get. So digitizing healthcare records and healthcare workflows are very, very important, because if you see, more than in the US, 6 out of 10 people are not even in direct patient care. They're all doing administrative work, and out of the remaining people who do actual patient care work, almost in the nurses, they do more than 40 to 50% of the work is non care work. So we have to use technology and various AI tools to reduce these times, so that they get more time to be more empathetic and compassionate in the care towards the patients. And that is where the fine balance is, and that is where we need to strike the fine balance.
Well said. Now I'll move to Dr. Oma Nambiar. She's a veteran in healthcare. I know her, I don't know, for the 2 decades. She has worked in corporate hospitals, trust hospital, and now she's heading a healthcare vertical with Indian Institute of Science. Ma'am, with the rise in teleconsultations, how can healthcare institution maintain the human touch and an emotional connection that often come with face-to-face interaction between the patients and the healthcare professionals? Just you, ma'am.
So, I mean, all right. So, thank you, Neeraj. Uh, so telehealth by itself, when you say it is remote in nature and it is not direct person to person physical interaction, that's by definition telehealth for you. So if you really look at the entire digital health ecosystem, and that's what we should be talking about, on the one hand is the diseases or conditions or just plain simple communication with the healthcare system, a healthcare provider, with the patient or just ordinary citizens, and that is where you will use the remote healthcare ecosystem or the telehealth facility. In COVID, there was no choice, there was no physical facility available. So every interaction happened through telehealth. But in ordinarily, if you look at it, acute care will still require going to the hospital for a physical one-on-one care, which again, as Emmanuel said, needs to be digitized as much as possible so that you free up time of doctors and nurses to increase more one-to-one patient and the healthcare provider physical contact opportunity. But in telehealth, we must remember that we can use it for either plain just education, communication regarding your, whether you need to go to the hospital or you don't need to go to, taking appointments, registrations before you go, understanding or supporting the whole care, home care, and also follow up after surgeries where you don't need to travel all the way to a large healthcare facility. It's an integral part of the entire digital health ecosystem. Post COVID, there is a downturn in use of telehealth. It's because patients who needed to go to the hospital physically have started going back to the hospitals, and there is again some mindset change, which is, some people still like to go to the hospital because they have nothing better to do at home. They're retired, they're leading this is an outing. But it will be an important business entity in the healthcare system.
Thank you very much. Now, my dear friend, Mr. Raj Gore, who is the Group CEO with Healthcare Global Enterprises. Apart from his healthcare, he loves birds. He visits so many forests. I don't know how many photographs he has taken. He's close to the nature. So now I'll talk about technology, which is away from all those things. In what ways has technology improved healthcare accessibility, and how can we ensure that these development do not lead to the reduction in the quality of human connection with the healthcare setting?
So,
See you.
thank you, Neeraj. First of all, thank you for having me here, and thank you to all of you for being here. Um, I think this topic is a little bit more nuanced. We need to look at it as not binary, not black and white. While teleconsultation is not in person, face to face, but think of it from a different perspective. In India, accessibility, availability is a major issue in healthcare. The disparity between urban and rural is even bigger issue, right? So I think giving that access to consultation through teleconsultation in a remote area, for me, is very humane. I don't see it as something contradictory to what we are trying to achieve and why we've joined healthcare. We saw during COVID, we see it even now, that in healthcare, all of us have done amazing job in last 2-3 decades to bring the best medical technology whenever it's available in the world right away to Indian patients. Today we have everything that is available in the rest of the world immediately in India. But one of the things that I think as a sector we are behind is what every other sector, how they have used technology to be more to solve customers' unmet needs, expectations, demands, right? Today, all of you, if you forget something to order for next day's breakfast, at 2 a.m. you can order it. But if your child has a fever And if you need an appointment tomorrow, you will struggle in most places with most hospitals, right? So I think it's high time, we have always built hospital healthcare setup to suit us, to suit caregivers. And that is because there's such a demand supply gap that we don't have to be so customer or patient oriented, because there are not enough hospitals and doctors, right? But in other industries, people have given more information, more comparison, more transparency. This is a era of, uh, you know, meeting customer needs last mile by one click, one link, one app, one call, right? And I think as healthcare industry, we need to do more and more in that. And that I think goes hand in hand with our core purpose of bringing the best of medical quality to our Indian patients. So I don't look at it as a, this or that. I think we are achieving both. I think as an industry, we need to do more on, when a general Indian is used to used to consuming service and products in a certain way through this device at any point, any time, anywhere, I think they will expect, that from hospitals also. And I think the best way to do it is give patients choices. If they want to come, they can come. If they want to call, they can call. If they want to do through chatbot, as long as you give that choice empowerment to them, the balance will always be there. And then you don't have to worry whether face-to-face time is there or not, because patients are choosing to access you through that, and it's their choice.
Great. What you're saying is true. I think there is one thing which is going on in Indian healthcare system, not in India, across the world. Healthcare is moving away from the hospitals. So hospitals are meant for ICUs, they're meant for procedures, OTs, and so on. And while the teleconsultation, your health checkups, and everything is happening there. Like recently, Apollo has taken a health checkup on wheels. So it is like a Shah Rukh Khan vanity van, because say for example, SDFC people is not coming to the hospital, to get their health checkup done, because some of the youngsters feel there is no need for health checkups, though their company is empaneled with them. So this kind of a bus goes to their company, park outside, and turn by turn you go inside and get your screening for a health checkup done. My next question to Dr. Sujit Paul. He is a group CEO with Zota Healthcare Limited. So, are there specific technologies or tools that have proven particularly beneficial for enhancing patient and provider relationship, and how can these be integrated more widely across the healthcare sector? Your feedback on your comments on that.
Sure. Thank you. So I have crossed the genre of being part of the largest hospital chain that India have. I have crossed in the clinic section, and now I'm part of the largest generic retail pharmacy chain that India have. Now, how I see things is that India, when we talk about technology, when we speak about AI, India is far, far away from that, and that's the reality. We are talking in a air-conditioned environment where we have amazing hospitals, when we see teleconsultations happening, when we see the integration and amalgamations of machine data with patient integration that happens. But the reality of fact is not actually there. If you go to interior of Chenapatna, if you go to interior of Rajasthan, if you go to interior of Bengal, that's where your patient lies. I take care of medicines. When we work in pharmacies, we see that whatever we speak at this point of time are for a small section of less than 1% that we are actually speaking. It's time that we need to wake up to understand that we need to talk and work on the larger mass of India, be it the larger hospitals, mid-sized hospitals, clinics, and pharmacies. They're all speaking and talking towards a revenue generation through technology on the upper genre that India have. But trust in me, India needs much, much more deeper penetration at this point of time. And if we don't realize it today, more people will die in the villages. I work in the villages. I see what is the situation there. If a physician prescribes morning, evening, night, they don't even have that amount of money to buy expensive drugs. Where does technology comes there? They break the pills and take, and that's the reality that is happening today. If you go to the villages, if you go to that 99% of people in India, then you will actually understand that the entire integration of this tele thing, the entire integration of this automation first need to get into a penetration segment. Once it gets into a penetration segment, we work on a mass scale to operate, then we see the revolution. Otherwise, it's too small a size that we are talking about, and the actual mass is still deprived.
While working in one of the hospitals, we have installed IP cameras, CCTV cameras, which used to capture the moods of the patients, right? So say, for example, a doctor is coming in the morning, his happiness index is 75%. And in the evening, he is going, his happiness index has gone down to 15%. So a CEO of a hospital will call him up and say, hey, doc, what happened? What we have done? Either workload was more or what happened? Technology benefit, but sometimes, technologies take away from the patients and the healthcare. Like I've seen most of the hospital, they say healthcare with a human touch, So all those things are there. So I think right balance between the technology and human interface is there. So now, since we are talking about technology, so my next question to you, Dr. Emmanuel, as healthcare become more digitized, what do you feel, what are the strategies can be implemented to train and educate healthcare professional to maintain the strong interpersonal skill and empathy while they interact with the patients?
See, communication training has to be there, but I think all students and as they go through the ladder, they need to go through a mentorship program and see how people communicate. And communication, how much ever you want to train, it's also an aptitude. Some can communicate extremely well, some cannot communicate well. But the thing is, they need to show empathy. You may not say many things in words, but you need to show in by actions and gestures that you are empathetic. The first thing is the patient needs to feel that you have listened to him, and you have considered all the things which he has told, and then you have taken all the inputs and done that. And sometimes this can become very time consuming, and that is, or he might be saying something which you might feel it is not relevant. So you might cut in and very be curt and be very asking the lot of other kind of questions. But technology is here, and there are a lot of conversational bots. There are a lot of bots which can interact and have the preliminary information which can be put into the system, so that the doctor, when he meets, already has a background information, and he can tell that this is what you have gone through in the last few months, weeks, whatever it is, and say this is what it is, and then ask very pertinent question, and this gives a whole lot of difference. In some of our hospitals, we have senior nurses taking very structured history prior to them meeting the doctors and putting the information into a structured format in the system. We also have introduced a system where voice to text, while the doctor is conversing, we can have the entire system, summarizing what has been heard and put into a very structured, clinical notes into the system. So all these things, data is very, very important. As we go, the challenges for India is very many, as has been enumerated. There are big, vast differences between rural areas and the urban areas and various other things. But if we don't digitize throughout uniformly and across the entire network, we won't know what is the actual burden, what needs to be done. And how do we know? And adherence to medication is one very important thing, and very simple things. Adherence to hypertension medication, if you don't do, you'll end up with major problems. Adherence to diabetes medication is this one. And these are all, major problems for India as we go. And it's not just about detecting, it's across the entire continuum of care that the technology has to be used. We have to do it across the entire network. And while we free up time and space for the healthcare workers to do what they're actually trained to do, all these things, the empathy and all these things will actually follow. I just wanted to make one small quick comment to what you said about telemedicine. It's very true. But we've also seen that people are very conversant with using WhatsApp. So people send health records through WhatsApp images. They just take a photograph and send. You are aware, and we've seen during the COVID when there was a lot of lockdown, a lot of people from West Bengal used to reach out to our doctors, and we've seen one incident where we have a video recording of that. This patient is under a tree in a rural setting. His son is holding the phone and holding the camera. He's conversing with the doctor, and and the health records are with the doctor, and he's conversing and doing that. But telemedicine, like what ma'am was saying, the more accessible you have access to care. You don't want telehealth at all. You want to have a face-to-face conversation. We've seen patients in Gurugram don't use teleconsults as much as they have the access and everything. But in a rural area, they will use telehealth more common than what you want. So there's a lot of issues across the entire spectrum of this one. But going back, I think training is very important. Mentorship during the training process is also very important as we go along. Thank you.
Really, right. I think whenever we use technology, I think we have to train the manpower, because healthcare managers and trainings is of not that level. Ma'am, there is one term known as laptop managers. Now you find in hospital, most of the people are sitting on a laptop, and they don't know the real word. And something known as real operational manager. They go to the ward and see what is happening in the patients. So, can you share certain examples from the institution you have worked and you have seen where the integration of technology has successfully improved patient care while still prioritizing the human touch?
So I would tell you that most of the models that we work in today, and how much ever we try, I don't think we are all there, because when we talk about full digitization in a hospital today, as of now, we are still talking about replacing paper with computerized EMR or an HIS system. We have not say none of the hospitals have got a fully 360, I would say, digital operations, or which is a truly smart care system, where almost all your mundane activities can be fully automated and you don't have to be there, which then enables you to move around. You don't have to sit at a place, because it's all based on mobile technologies, and you can move around, interact with patients. And so I'm talking about all the managerial or the administrative stuff. Very limited use for actually sitting on your workspace, at your dedicated workspace and working. I think we are far from there, because while we are trying to crack the game on an HIS which can be integrated with EMR and the other, I would say, your ERP systems and the HR and the inventory management systems, and also your what I would call it a smart building management system. All that comes together to make it a completely fully automated, where you can track your processes through the smart systems in the hospital, whether the patient movement, if the patient is delayed. You don't have to sit at your workspace. Very limited time that you need at workspace. But the journey to that space has started. I would say a lot of hospitals today, when you see, at least not only the big corporate hospitals, but also the rural hospitals, and that is courtesy the National Digital Health Mission. A lot of rural hospitals also have started embracing digital technologies to do more and more work in an automated manner. A lot of people feel that digital means just replacing what you were doing on paper and just copying it on the computer. That should not be the aim of digitization. We should do process efficiency. If you have a 10-step process when you were doing in a non-digital world, you should be able to reduce it to a 3 or a 4-step process. Free up your time so that you're not sitting at your laptop all the time. And Most of these technologies are now getting transferred to a mobile handheld technologies, so you don't have to really sit at a fixed location. You can work from anywhere in the system, including from your home.
Right, ma'am. Truly. We have created in our hospital something known as smart rooms. So the use of these smart rooms are, so whenever patient is there in the room, so for small thing, he require a nurse, like my room is not clean. Please, I want to see sun. Please, I want the AC to put off, because these are the nuclear families, sons and daughters and family don't stay with them. So the use of these smart rooms are that patient can speak. I want to hear R.D. Burman song, which one? Then starts. Please close the light. I want to go washroom. Please open the light of these things. So he's interacting with the room and getting done. However, for his medical needs, there is a typical call bell system which he calls and comes. So now, my next question to you, Raj, is how do cultural and regional differences impact the acceptance and effectiveness of the technology in healthcare, and how can these variances be addressed to ensure a universally balanced approach? What are your thoughts on that?
So Neeraj, if you have a smartphone, any place, any room can be a smart room or smart place. You know, the willingness to adopt technology among Indians, it's amazing. Prior to COVID, a typical technology user or an internet user was a metropolitan millennial male. We know that in 3 years of COVID, women are 48% internet users, went up from 26%. Age group 45 and above is as big as millennials. And rural is actually bigger than urban. If you talk to Googles and Airtels and all, they'll tell you that their data consumption is highest in rural areas. So I think it's the rural area, it's the remote areas will adopt technology faster, because that's the only way they can meet their needs. It's like how India leapfrogged over copper network through mobile network. So I don't think, I have full confidence in Indians that irrespective of your education level and all, the technology adoption, they are brilliant, because it's in our genes to find ways, irrespective of what our situation is and what our resources are. So I don't think cultural differences and all will play that big a role in the adoption of technology across India.
Right. I think well said. I think technology, I am for technology. I'm not against technology. Say, for example, we have 77 critical care bed, but we manage 1,500 beds while sitting in one location. So we have connected all the ICUs, which have a concept known as e-ICU. So dashboards are there in one of the hospitals, and our critical care specialists give the feedback and give the treatment to the patients who are sitting far away, as far as 200 kilometers away. So I think if technology is there, we can reach. And as you rightly said, Indians are very fast in catching up technology and making use of it. So now my next question to Dr. Sujit Paul. In what ways can technology be harnessed to enhance communication and collaboration among healthcare professionals while also fostering stronger relationship with patients? What's your thought on that?
Yeah, I think we have seen how India have moved across, and with especially data costs coming down in mobile. I think you have seen the fingers have started been used much more. People have keep scrolling up on the reels, right? So if a physician writes a specific medicine, if it's a OP, so and when the prescription hits either on the pharmacy of that respective hospital or the pharmacy outside, it could be a mom and pop. We have close to 19.5 lakh pharmacies in India. Now there is where the technology need to play, because please understand that there's a specific dosage that comes into the prescription. It could be say 3 tablets 2 capsules and 1 syrup. And when the reminder happens, if the hospital system with the pharmacy system gets actually integrated, which Government of India is working on it now, so then there's a tremendous amount of stickiness that would happen. And not only that, we will see India evolving much better. For example, if there's a simple throat pain, people will stop taking erythrocin, azithromycin, etc. There is overusage of antibiotics that we all see. If there is a simple headache, people just pop up whatever, Saridon, Disprin, whatever. So we'll see all this getting stopped, and we will also see that refill reminders. We'll also see the actual medication movement going through much more on a rational note, on a deep penetration, both urban and rural. So what the Government of India is currently working, because we are part of that, so we know that once this chain gets completed in the full loop, through this technology piece, I think right from the physician, the customers, and caregivers, and the pharmacies, all would get integrated, and we'll have a much healthier India in totality.
Great. See, I feel healthcare workers, right from doctors, nurses, paramedics, and the housekeeping or a patient care attendants, I think technology has been used in various, they use technology as per whims and fancies. Like say, for example, one of the most important pain area in the hospital is transfer of the patients from OT to ward to ICUs and all. So we attempted to use a porter application. So we were fed up with this housekeeping team. We have taken a young boys and girls, and they are porters, a patient transport team, 10 girls from Saurashtra region of Gujarat, and the application is given to them. So these girls and boys, they were having a smartphones, like Raj was taking, everybody is using smartphone these days, and a staff nurse, if she want to transfer one patient from 4th floor to a CT scan, they see which is the closest porter. And they log on to that porter come with a wheelchair, transfer the patient from the ward to the CT, and they're not waiting. She moves away for the next work. It is like when we book a cab and goes there. So I think technology can be used, but I think what I feel, it is not used uniformly across all the people. So that is a major challenge. So now, in order to sum up, I want one thoughts from each of you as leaders in healthcare institution. How do you envision the future trajectory of the human touch in healthcare amidst the continuous evaluation and integration of technology? We take from Dr. Saujit first.
Sure. How I see and what I feel should be done and what we should evolve is that technology should definitely ensure that the cost of care comes down. Now that's extremely important. Whatever it is, since we work extensively in the cities and in the deeper villages, and we are into government, this thing. So we find that unless we really pull down the cost, whether it's the treatment cost, whether it's the cost of medications, whether it's the cost of overall healthcare, India would not reach to that level of health, what it should reach, and that's the foremost important, that I feel so.
I think like all the panelists mentioned, we are just beginning in our journey to adopt technology. We are just putting the foundational block. So we've not harnessed the full power of technology yet. So it's too soon to be judgmental. I think we need to persist with it. I have very firm belief that many of our major challenges, whether it's around availability, accessibility, affordability, talent crunch, improving clinical outcomes, technology will play a tremendous role and help us get where we want to get in a faster time frame than what we have achieved till date. I think technology is here we create technology. Technology is here to aid us in pursuing the purpose that we want to pursue. And therefore, I believe, there's a lot of debate on AI and generative AI and all. And there is a quote by Eric Topol, who's a cardiologist, scientist, and a thought leader in healthcare. And he says the real opportunity, real potential of AI is not to reduce workload, reduce error, or even to cure cancer. It's actually to restore connection and trust, the human touch between patient and the doctor. And I firmly believe it because we are right now talking about EMR and time taken 70% to fill that. But there is a technology now where you don't have to do it and you can look in the face and have a conversation, and the technology will capture that conversation in pretty much 80-90% accuracy. So I believe that it's the technology which will help us to further strengthen this human touch going forward, and we need to keep pursuing it.
I fully endorse the views that Raj has expressed. And I would say that the speed at which we are moving towards adoption, and I think we are really reaching that critical mass, thanks be to COVID for having spread the word around and made it easier for all of us to understand not only the potential of the digital technologies, but also to remove the fear of not having to see the doctor for every little pain and fever that one had. We understand what are the actual moments where you need to seek a physical one-on-one interaction with a care provider. But having said that, we now know that across the world, human beings as a species, we depend on everything in our life for digital technologies having made it easier. I mean, who goes to buy a railway ticket now or a flight ticket now? I mean, good heavens. And this is something that we've done 20 years ago, 30 years ago. Today's generation doesn't even know that there was something called a ticket counter, right? So when everything is happening through your smartphone, it is but natural that our confidence or in fact the demand from the population to seek healthcare through the smartphone will become very high. And the healthcare providers will also catch up and provide that opportunity. Having said that, as far as I also feel that digital technologies is the one technology that is going to not only address the issue of quality and access to healthcare, which everybody knows, but it will build the confidence and restore the trust between the doctor and the patient community by bringing in more ethics and transparency to the entire healthcare, and which has been eroding in the past so many years, and I think it's time to restore that back. I have full confidence that this is the only way that as human beings, as a group, that we really need to restore that trust back in the healthcare community. And as far as touch is concerned, it's not only just now you have haptic sensors being developed for remote touch. So I don't think touch is going to be a question anymore.
Thank you, ma'am. Now the final word from Dr. Emmanuel.
Yeah, I endorse all three views. I think we need to move to very rapidly into a situation where we digitize all our requirements and records. Around 6 years back, we started our own development of the hospital information system, the HIS, and now we have the lab as well as the radiology information systems, and we have an analytical team. We have around 250 software engineers working with our doctors to tailor-make the entire system to the needs of the people. And we have digitized everything, and we have approximately 3 million consultations every year. So you can see the amount of data that is available for us to look into everything. So we have digitized ECGs, everything is digitized and put into the system for that to be utilized. But that is the direction in which the country has to rapidly grow. And if healthcare is as complex as the airline industry, and if pilots and co-pilots have to depend on instruments and technology, I think the healthcare also has to move very rapidly into that to take India to the absolutely a different level for accessing care, and also for the various other, the quality of the care that we will be able to provide. And it's possible. It's not something that it's not possible at all. When I was training around more than 30 years back, except for some premium institutions and both in government and in the private sector, not many people used monitors in the operating room. I used to know that. And everybody used to say it's a question of cost. And we were told you have to hone your clinical skills and you need to be this one. But there was a mandatory thing said, minimum mandatory monitoring in the operating rooms. And that changed the whole phase. Now, I don't think there's any place across anywhere in the country which does not use safe practices like these things. And I think this will change, and this is here to change. And the moment we capture all these images, I mean, the records across the entire network, through the digital health mission of the government and various organizations putting it, and then we have an interoperability of this, you will have amazing things being done in that. You know, our engineers are able to, we have sent it for publication, I mean, it's still under review. From ECG, we can predict whether somebody has got a poor function or LV function or a good LV function. That's all, you know, as simple as that. That can be an initial screening tool. A lot of things will need to be changed. It's a work in progress, but I think the next few years is going to be very interesting to see how it's going to evolve.
Great. Thank you very much for this wonderful thoughts. And I think we are in the safe hands. I was reading somewhere, healthcare is second last in the world across various vertical after shipping in embarrassing technology. I think that will change gradually. And I feel a time will come when, when you enter a hospital, there's a 2 OPD. If you want to use a digital technology, go there. And if some old people or some senior citizens are there, because still they have a challenge. So I think a time will come, tools will get developed. Give a big round of applause to the speakers and the panelists we have interacted with them. I think that is a way we should work, and we should have a good balance between a human touch, where we have a face-to-face interaction with the medical team, as well as using technology in order to have a great patient experience and to reach healthcare to the remotest corner of India. Thank you very much. We have just 1 or 2 questions, and we are on time, 2 minutes, 36 seconds. Yeah.
Can we have the mic, please?
Yeah, quickly, I have only one question. I'm talking about the wearables. Now, wearables are restricted to only sportsmen in this country, unfortunately. Wearables should be such that all the information available on the wearable from a senior citizen or from any patient should be immediately transported to the doctors and to various mechanisms where the treatment should be automatic. It should be interactive, more than just somebody coming and taking a wearable as a fashionable thing. So we should extend this wearable to all the patients, and all the recordings like ECG or BP or pulse, etc. should be immediately transported to the concerned department and the doctor for treatment. Not only personalized treatment, it should be through AI interactive. Thank you.
I think you are right. There are certain technologies which is available while patient is there on the bed. All the parameters of the patient can be monitored, and a nurse and a doctor can see from there. Somebody want to take this? Yeah.
So a lot of telemedicine companies as well as a lot of hospitals are already in the process of gathering this data, using it for preventive purposes, following up, and also using it in the AI applications for larger population health related studies as well as advice that will be developed in due course of time.
So I'll just add on to your piece and endorser. See, wearables, when you wear, and the technology is coming to that level that in the moment you enter into the hospital Wi-Fi zone. So, and if you have a consent on that, so your entire body records get captured onto a database of the hospital. Now, once that gets captured to the database of the hospital, depending on, of course, on a larger macro view. So even that, whether you have to see or meet a cardiologist or a neurologist or a GP at first. So you don't need to kind of, go out to the reception and figure it out. And then you straight go there. And by the time you are actually hitting up to the doctor, half of your data is already in the screen of the doctor. So the doctor saves time, you save time, and even if it's a geriatric patient, so they can't explain well. So that the data that is there in your hand, or in wherever you would like to wear, so it actually gets connected to the hospital system, and thereby even now the technology is evolving to that level that you will get machines where even you don't need to consult a doctor. The machine will tell you the preliminary part of it. Based on that, where is it that you need to go, whether you'd like to go for a checkup or you need to go to a pharmacy. So I think we are all evolving. So as everyone said, we are on the journey of evolution. So I think we need to be patient on that.